Royal Melbourne, Mike just doing here. Now we've loaded a 20-year-old male, 3 gunshot wounds to the lower back.
At the Royal Melbourne Hospital, an urgent call has come through from paramedics, rushing a critically injured gunshot victim to emergency.
3 individual bullet wounds to his back.
Royal Melbourne received. We'll see you in 15 over. Thank you.
In a gunshot victim, the injuries can be really unpredictable because some bullets are designed to actually explode inside the body cavity and do the maximum amount of damage. And what I'm thinking is there problems with bleeding that we need to stop that's going to cause this gentleman to bleed to death within a matter of seconds to minutes?
The gunshot victim arrives under heavy police guard.
So if the police are here, what are we doing about security?
The shooter is still on the loose, and there are fears he may try to get to the patient in hospital.
1, 2, 3.
That gunshot went off for a reason. What was that reason? Am I in a dangerous situation right now?
There are security concerns with that patient.
It's warm. It's such a very unknown, heightened experience to be in.
Paramedics who rushed the gunshot victim to emergency are giving Dr. Sarah and her team vital details about his injuries.
He's been shot with, we think, a small caliber gun. 3 gunshot wounds. He's pale, sweaty. He feels a little bit short of breath and has been grunting at times.
With a gunshot wound that's high velocity, high force, it can cause almost any type of internal injury. It is a life-threatening situation.
We're just going to roll you and have a look at your back, okay?
The emergency team is searching the man's body for bullet entry and exit wounds.
So, got a entry wound right mid-thoracic, just off the right of the midline. Right loin, 2 on his left thigh, 1 on his left calf.
They identify 6 visible wounds. But worryingly, not all the bullets are accounted for.
X-ray there, guys.
An X-ray reveals a potentially fatal injury.
That's one of the bullets that's still left in this gentleman's chest. So this is his heart here, and it should be over in the middle of his chest, and it's not. It's squished over this side, so this lung has collapsed down quite significantly. And then the question is, has another of the bullets gone into the abdomen below the diaphragm, and is he bleeding from anywhere?
The bullet in this patient has actually punctured the lung, and the lung itself is deflated and it's leaking air into the chest cavity. It's really important that we go in and make a small hole through the chest wall and release that air and any blood that's in there so that it stops squashing the lung and the heart towards the other side of the chest. This is something that could definitely kill this patient if we don't release that pressure.
He's become tacky.
Yeah, very, very tachycardic.
We didn't know where the other bullets were, so if there was any injuries to his neck and to his spine, that's going to stop his breathing immediately.
As the doctors make an incision for the drain, the patient's heart is starting to beat very fast. His collapsed lung is losing air and pushing harder against his heart.
Just going to give you some more oxygen, okay?
Essentially, more and more air has come from the damaged part of his lung into the chest cavity, and that has pushed his heart over further, and eventually those blood vessels to and from the heart would have become so kinked that his heart would stop beating and he would die.
In Trauma Room 1, Dr. Sarah Whitelaw's team is carrying out a life-saving procedure on a gunshot victim whose lung has been pierced by a bullet. Police guarding the patient are on high alert as the shooter is still at large.
What we need to do is actually make an incision to drain the blood and let that lung fully re-expand. And we need to do that pretty quickly.
He's sore, that's hurting him. We need more analgesia.
It's painful to have this done. This gentleman's probably got a lot of muscle, and that makes it quite difficult to actually get in through to the lungs. There's quite a lot of blood coming out of his drain in the chest.
With gunshot wounds, you always have to expect the worst case possible. You know, some will enter and they don't come out, or they'll enter and then shrapnel just gets spread in their body.
And I don't have any exit wounds. Is that right?
There's no exit wound.
It's very likely that there are still full bullets or fragments of bullets still left inside this patient.
Dr. Sarah's calling in a specialist surgeon to remove any remaining bullets in the operating theatre.
Sarah Whitelaw here, one of the ED consultants. We have a 20-year-old gentleman who, within the last hour, has had 6 gunshot wounds. He's having a chest tube put in on the right.
The gunshot victim needs a CT scan urgently to locate the bullets in his body.
You comfortable, Annalise, with that plan? If he stays as stable as he is, that we will go to scan?
I just want to know where, because if he's got penetrating, he's got a gunshot in his abdomen, chest tubes, haven't had a chance.
No, absolutely. It's just impossible to tell from the bullet hole itself whether that bullet's gone up that way or that way or that way or that way. So if it has gone into the abdomen, then there is a chance it could be causing bleeding. We need to keep the momentum going and get him to CT.
Moving the patient just a few metres from the trauma to the CT scanner is potentially deadly.
If that tube falls out or kinks, that lung could collapse again and that could cause the patient to become very unwell or even die. He walked for 10 or 20 metres after being hit and then kind of collapsed down. So I don't think he's... We're very used to dealing with patients that can't give us a lot of history. So it is useful to be able to get information about perhaps the type of bullet. It gives us information about the damage that that bullet might do. That confirms what we saw on ultrasound.
The CT scan reveals the dangerous extent of the damage the bullets inflicted on the victim.
The CT confirms that the chest drain is in the right place, that there is that ruptured lung and there's a bit of bleeding from the lung. There's also quite a few bullet fragments in the chest itself, along the surface of the ribs, and some bullet fragments around the liver as well. So it's hard to tell how many bullets are in the chest and the abdominal cavity because there's lots of fragments everywhere. The police are obviously very keen to get the bullet.
There'll be a couple.
So
Dr. Sarah is handing over the patient to surgeons who will operate on him immediately.
So I think he's going to theatre for a laparotomy.
After a marathon shift, Sarah can finally head home.
That's one of the things that I love about emergency medicine. Most of the time we manage to make things a bit better. Sometimes we make it a lot better and sometimes we save lives.
That's hurting him. We need more analgesia.
Dr. Sarah's gunshot victim's life was saved after surgeons removed multiple pellets from his chest. They repaired his diaphragm, which had been ruptured by a bullet, a hernia, and part of his liver, all complications from the gunshot attack. He was discharged a week later.